Hi guys, you are watching my YouTube channel, Hidden Facts. This video is part 3 of Coronavirus A Complete Guide. I recommend you to watch other 2 parts of this video. Kindly like the video and subscribe the channel. Let's move to our topic. Coronavirus in babies and children. How to protect your kids from the coronavirus and COVID-19. Milston says, children are exposed to COVID-19 when the virus contacts their eyes, nose, mouth or lungs. This usually occurs when a nearby infected person coughs or sneezes, which releases respiratory droplets into the air and onto the child's face or nearby surfaces such as tables, food or hands. He says the best way to prevent children from becoming sick with COVID-19 is to avoid exposing them to people who are, or who might be, sick with the virus. Avoid crowds. Keep kids away from crowded areas when possible. Stay away from sick people. Keep children at least 6 feet away from anyone who is sick with a cough or fever, including family members. Hand washing and coronavirus prevention for children. How to wash hands. Milston advises parents to teach kids to wash their hands regularly, with soap and warm water, for at least 20 seconds. They can help keep track of time by singing the ABCs, which takes about 20 seconds to finish, he says. When to wash hands. Kids should wash their hands after using the bathroom, sneezing, coughing or blowing their nose, before eating, even snacks, and immediately after coming inside from playing outdoors. Kids who balk. Milston says, if your child is refusing to wash their hands or becoming very upset when asked to do so, it might help to give them a small reward, such as a sticker, to celebrate each time they wash their hands. Compliment them for doing a really good job while washing their hands. It also helps when parents set an example by washing their own hands frequently. If soap and water are not available, Milston says the next best option is hand sanitizer. Other coronavirus prevention tips for families. Cough and sneeze with care. Encourage everyone in the family to cough and sneeze into their elbow, instead of their hands, and to wash their hands after each time this occurs, Milston says. Throw away tissues after they are used, he adds. Keep hands off faces. Parents should remind children to avoid touching their face as much as possible. Milston says it can help if kids carry a toy that will keep their hands busy, but he notes that parents should wash those toys regularly. Keep things clean. Wipe down toys and surfaces your child touches regularly, especially when traveling or when near a person who is sick. Clean surfaces at home and store cleaners in cabinets that are either too high for your child to reach or are secured with child-proof cabinet locks. More cleaning recommendations are available from the Centers for Disease Control and Prevention. Address anxiety and stress. Talking things over as a family can help identify specific fears and clarify the facts. It also helps for families to discuss a plan in case someone gets sick, if a school closes or something else happens that interrupts the normal routine. Children will look to you when deciding how to feel about COVID-19. If you feel calm and prepared, they are likely to feel similarly, Milston notes. Children with medical conditions. Asthma. Children with asthma may have more severe symptoms from COVID-19 or any other respiratory disease, including the flu. As yet, there are no indications that most children with asthma experience severe symptoms due to the coronavirus, but observe them carefully and, if symptoms develop, call the child's doctor to discuss next steps and to arrange appropriate evaluation as needed. Diabetes. Control of blood sugar is key. Children with well-managed diabetes are not expected to be more susceptible to COVID-19, but poorly controlled diabetes can weaken the immune system, so parents and doctors should watch these children carefully for signs and symptoms that may require evaluation. Kids and families can reduce coronavirus risk together. Though much more is yet to be understood about the new coronavirus, COVID-19 seems to have less serious health consequences for children than for adults, which is encouraging news. Still, it is important to avoid infection among children and help prevent the virus from spreading. Families with children can work together to reduce the risk. Are COVID-19 symptoms different in children than in adults? The symptoms of COVID-19 are similar in children and adults. However, children with COVID-19 generally present with mild symptoms. It is rare for children to get so sick that they need to go to the hospital due to COVID-19. Reported symptoms in children include fever, cough, sore throat, difficulty breathing and diarrhea. It's not known yet whether children with underlying medical conditions may be at a higher risk for severe illness compared with otherwise healthy children. We are all still learning how COVID-19 impacts children. It's important to follow guidelines if you think your child is sick with COVID-19, and if your child is diagnosed with COVID-19, what are the signs that a child with COVID-19 requires immediate emergency medical attention? Emergency warning signs include difficulty breathing, inability to keep down any liquids, new confusion or inability to awaken, bluish lips. How can I protect myself and others from the new coronavirus and COVID-19? Avoid close contact with others. It's important to understand that the new coronavirus spreads mainly from person to person. If an infected person coughs or sneezes, their droplets can infect people nearby. That's why it's important to avoid close contact with others. Understand that people, including children, may be infected with the new coronavirus and have only mild symptoms. Some measures you can take to avoid close contact with others include, stay home as much as possible and reduce visitors. Practice social distancing, stay at least 6 feet away from others in public places. Call friends and family or visit by video. Ask your employer if it's possible to work from home. Avoid people who appear sick. Go grocery shopping and run errands during off-peak times. Healthy people do not need to wear a mask unless they are caring for someone diagnosed with, or being monitored for, COVID-19, or respiratory illness. Practice good hygiene wherever you are. The new coronavirus can survive for hours or even days on some surfaces. Touching a contaminated surface and then touching your face is one of the ways to become infected. The virus is no longer detectable on plastic after 72 hours, and on stainless steel or cardboard after about 48 hours. With that in mind, wash your hands with soap and water frequently and thoroughly for at least 20 seconds, especially after being in public places and touching door handles, shopping carts, elevator buttons, etc. After using the bathroom. Before preparing food. If soap and water are not available, use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose or mouth, especially with unwashed hands. If you cough or sneeze, do so in the bend of your elbow. If you use a tissue, throw it away immediately. Take precautions if you are living with or caring for someone who is sick. Wear a mask if you are caring for someone who has respiratory symptoms. Clean counters, door knobs, phones and tablets frequently, using disinfectant cleaners or wipes. If you feel sick, follow these guidelines. Stay home if you feel sick unless you are experiencing a medical emergency such as severe shortness of breath or a very high fever. Call your doctor or urgent care facility and explain your symptoms over the phone. If you leave your home to get medical care, wear a mask if you have respiratory symptoms. Thank you for watching the video. Hope you get wonderful information about prevention from coronavirus. Goodbye and take care.